This lecture is on oral antihyperglycemic drugs for patients with type 2 diabetes. This is lecture number 6 of the diabetes series. By the end of this lecture, you should be able to discuss the nursing considerations for each of the antihyperglycemic drugs. This requires you to know the site and mode of action of each class of drugs. This also requires you to assess and monitor for the effects of these drugs, which will enable you to do a patient teaching on these classes of drugs. Remember, in lecture 1, we said that there are 3 sources of glucose. 1, glucose comes from the food we eat. 2, glucose from liver production called gluconeogenesis. 3, glucose comes from peripheral tissues such as muscles. Remembering these sources of glucose will help you remember the 4 sites of action of oral antihyperglycemics. And these 4 sites are 1, the pancreas, 2, the liver, 3, the intestine, and 4, the muscles. Pancreas. An antihyperglycemic drug targeting the pancreas will do what? Increase insulin production. Liver. An antihyperglycemic drug targeting the liver will do what? Decrease glucose production. Intestine. An antihyperglycemic drug targeting the intestine will do what? Decrease or slow down glucose absorption. Peripheral tissue. An antihyperglycemic drug targeting the peripheral tissue or muscle will do what? Increase glucose uptake. This table came straight from your textbook. All I can say is you need to know this table by heart. I don't need to read this table for you. All I can say is you also need to know this table by heart. So, except for TZDs and DPP4 inhibitors, oral antihyperglycemics have to be taken with regard to meals. For example, an alpha glucosidase inhibitor has to be taken with the first bite of food because its site of action is the intestines and its mode of action is to decrease glucose absorption in the intestine. So there has got to be food in the intestine for this drug to be effective. A biguanide or metformin, even though its site of action is in the liver and peripheral tissue, you still would like to give it with meals to reduce GI upset. Drugs that target the pancreas to release insulin, such as sulfonylureas and meglitinides, these have to be taken with meals or just before a meal or up to 30 minutes before a meal. And because the mode of action of these drugs, sulfonylureas and meglitinides, are to release insulin, the risk of hypoglycemia is always present. The next slides will go into more detail about each class of drug. Sulfonylureas. The suffix is IDES or IDES. An example would be glipizide. The site of action is pancreas. The mode of action is to increase insulin release from the beta cells of the pancreas. Nursing consideration for glipizide. Glipizide comes as tablets and extended release or long acting tablets to take by mouth. The regular tablet is usually taken one or more times a day, 30 minutes before breakfast or meals. The extended release tablet is usually taken once a day with breakfast. To help the client remember to take glipizide, take it around the same time every day. Meglitinides. The suffix is glinide, and an example would be ripaglinide. The site of action is the pancreas. The mode of action is to increase insulin release from the beta cells of the pancreas. Nursing considerations for ripaglinide. The tablets are taken before meals, anytime from 30 minutes before a meal to just before the meal. If you skip a meal, you need to skip the dose of ripaglinide. If you need an extra meal, you need to take an extra dose of ripaglinide. Thiazolidinediones, TCDs. The suffix is glitazone. The example is pioglitazone. The modes of action are to decrease glucose production in the liver and to increase peripheral glucose uptake. Nursing consideration for pioglitazone for diabetes may cause or worsen congestive heart failure. Therefore, educate your patient to immediately report signs and symptoms of heart failure, which include large weight gain in a short period of time, shortness of breath, swelling of the arms, hands, feet, ankles, or lower legs, waking up short of breath during the night, needing to sleep with extra pillows under the head in order to breathe easier while lying down, frequent dry cough or wheezing, difficulty thinking clearly or confusion, fast or racing heartbeat, not able to walk or exercise as well, or increased tiredness. Biguanide, the example would be metformin or glucophage. The site of action or the mode of action is to decrease glucose production in the liver and to increase peripheral glucose uptake. Nursing consideration is use with caution in patients with renal impairment. So you need to instruct your patient this way. If you are having surgery, including dental surgery, any x-ray procedure in which dye is injected, or any major medical procedure, tell the doctor that you are taking metformin. You may need to stop taking metformin before the procedure and wait 48 hours to restart metformin. Your doctor will tell you exactly when you should stop taking metformin and when you should start taking it again. Alpha glucosidase inhibitors. Example is acarbose. The mode of action is to decrease glucose absorption in the intestine. Therefore, it is very important to take each dose with first bite of food. Nursing consideration is it reduces liver function. Therefore, you need to monitor liver enzymes, which would be AST and ALT. DPP4 inhibitors with a suffix gliptins. An example would be sitagliptin. The mode of action is to increase insulin secretion and decrease glucose absorption in the intestine. Nursing consideration, there is an increased risk for acute pancreatitis. Therefore, you need to monitor amylase and lipase levels. You also need to teach patients who are on gliptins to immediately report sudden onset of intense abdominal pain that radiates to the back, left flank, or left shoulder, yellow jaundice, blue gray or blue discoloration of the abdomen or periumbilical area. This slide shows you a discoloration of flank and periumbilical area. Here you see the gray Turner sign and the Collins sign. The gray Turner sign is blue or bluish or dark discoloration in the flank area. The Collins sign is discoloration in the periumbilical area. If you read the literature, the occurrence of gray Turner sign and Collins sign is rare. They could, but they do not always indicate pancreatitis. Management of both type 1 and type 2 diabetes cannot be successful without the individual patient's commitment to behaviors and lifestyle choices on an ongoing basis. Patient behavior strongly impacts hyperglycemia, with education and self-management critical to successful outcomes. This involves more than adherence to potentially complicated pharmaceutical regimens. It also involves education, diet, exercise, self-monitoring of blood glucose, and adherence to a screening program for complications. Please do not underestimate your role in patient education. Please click on the hyperlink to view a video on medication literacy. That's it for oral antihyperglycemics. This concludes lecture number 6 of the diabetes series. Thank you.